2 in our installment on agoraphobia in our mini mental health series. And in this installment, we are going to be covering the diagnosis and the treatment of agoraphobia. Before we begin, let me remind you to watch the full video because there will be 3 keywords mentioned in the video. I will say keyword and what the keyword is, so make sure you watch the full video. At the end of the video, in the comment section, along with a genuine comment about the video, put in the 3 keywords to be eligible for my free merch giveaway when I reach 2,000 subscribers. So let's begin. The diagnosis for agoraphobia is based on a couple of different things. One of the things that they do in diagnosing agoraphobia is they look at all the signs and symptoms of it. By doing an in-depth interview with your doctor or your mental health professional, they do a physical exam to rule out any other conditions that could be causing your symptoms. And then they go by criteria listed in the Diagnostic and Statistical Manual of Mental Health Disorders, better known as the DSM-5, published by the American Psychiatric Association. As far as the treatment for agoraphobia, the treatment usually includes both keyword psychotherapy and medication. It may take some time, but treatment can help you get better. The psychotherapy consists of working with a therapist to set goals and learn practical skills to reduce your anxiety symptoms. Cognitive behavioral therapy is one of the most effective forms of psychotherapy for anxiety disorders, including agoraphobia. Generally, a short-term treatment, cognitive behavioral therapy focuses on teaching you specific skills to better tolerate anxiety. Directly challenge your worries and gradually return to the activities you avoided because of the anxiety. Through this process, your symptoms improve as you build on your initial success. The things that you can learn in the psychotherapy will include what factors may trigger a panic attack or panic-like symptoms and what makes them worse. How to cope with and tolerate the symptoms of anxiety. Ways to directly challenge your worries, such as the likelihood of bad things happening in social situations. That your anxiety gradually decreases if you remain in situations, and that you can manage these symptoms until they do. How to change unwanted and healthy behaviors through desensitization, also called exposure therapy, to safely face the places and situations that cause fear and anxiety. If you have trouble leaving your home, you may wonder how you would possibly go about to go to the therapist's office. Therapists who treat agoraphobia are well aware of this problem. So if you feel homebound due to your agoraphobia, look for a therapist who can help you find alternatives to office appointments, at least in the early part of the treatment. He or she may offer to see you first in your home or meet you in what you consider a safe place or a safe zone. Some therapists may also offer some sessions over the phone, through mail, or using computer programs or other media. If the agoraphobia is so severe that you cannot access care, you might benefit from a more intensive hospital program that specializes in the treatment of anxiety. You may want to take a trusted relative or friend to your appointment who can offer comfort, help, and coaching if needed. As far as the medications, there are certain types of keyword antidepressants are often used to treat agoraphobia, and sometimes anti-anxiety drugs are used on a limited basis. Antidepressants are more effective, though, than the anti-anxiety medications in the treatment of agoraphobia. Some of the antidepressants used is Prozac, Zoloft, and they're used for the treatment of panic disorder with agoraphobia. Other types of antidepressants may also effectively treat agoraphobia. The anti-anxiety medications that they may use, which are sedatives that in limited circumstances help to temporarily relieve anxiety symptoms. Medications like benzodiazepines, which is used to relieve acute anxiety on a short-term basis. It may take weeks, though, for medications to relieve symptoms, and you may have to try several different medications before you find the one that works best for you. Both starting and ending a course of antidepressants can cause side effects that create uncomfortable physical sensations or even panic attack symptoms. For this reason, your doctor likely will gradually increase your dose during treatment and slowly decrease your dose when he or she feels you are ready to stop taking medication. Never ever stop taking your medication all at once. It can do a lot of damage. There is some alternative medicine available. Certain dietary and herbal supplements claim to have calming and anti-anxiety benefits. Before you take any of these for agoraphobia, though, talk with your doctor. That is so important. Don't just assume because people say they work. Although these supplements are available without a prescription, they still pose possible health risks. For example, the herbal supplement kava, also called kava, appeared to be a promising treatment for anxiety, but there have been reports of serious liver damage, even with short-term care. The Food and Drug Administration had issued warnings but not banned sales in the United States. Avoid using any product that contains kava until more rigorous safety studies are done, especially if you have liver problems or take medications that affect your liver. Now, how do you cope with agoraphobia and what is the support out there for it? Living with agoraphobia can make life difficult. Professional treatment can help you overcome the disorder or manage it effectively so you don't become a keyword prisoner to your fears. You can also take these steps to cope and care for yourself when you have agoraphobia. Stick to your treatment plan. Take your medications as directed. Keep therapy appointments. Communicate regularly with your therapist. Because consistency can make a big difference, especially when it comes to practicing skills and taking your medication. Try to avoid feared situations. It's hard to go to places or to be in situations that make you uncomfortable or that bring symptoms of anxiety. But practicing going to more and more places can make them less frightening and anxiety provoking. Family, friends, and your therapist can help you work on this. Learn calming skills. Working with your therapist, you can learn how to calm and soothe yourself by meditation, yoga, massage, and visualization are simple relaxation techniques that may also help. Practice these techniques when you aren't anxious or worried, and then put them into action during stressful situations. Always, and I emphasize always, avoid alcohol and recreational drugs. Also limit or avoid caffeine. These substances can worsen your panic or anxiety symptoms. Take care of yourself. Get enough sleep. Be physically active every day. And eat a healthy diet, including lots of vegetables and fruit. And most importantly, join a support group. Support groups for people with anxiety disorders can help you connect to others facing similar challenges and share experiences. So it can help you get out some of your problems, and maybe they can give you some tips on what helped them. Okay? So that is how it is diagnosed and treated. Um, Remember always to see with your heart and not with your eyes, because with the eyes see isn't important. What is important is invisible, completely invisible to the eye, because only the heart can see it. And if you can't walk a mile in that person's shoes, then don't say anything. And I can guarantee you none of us can walk a mile in somebody else's shoes, because we are all different. We do not know what each and every person is going through. We don't know if anybody is suffering from agoraphobia or anxiety disorder or PTSD or any other type of mental disorder. Instead of being someone that's judgmental, or even if you think it's okay and you joke about something that they're going through, put yourself in their place. How would you feel if somebody cracked a joke about what you're going through? You wouldn't like it. I know I wouldn't. So why do it? Instead, encourage, inspire, uplift them, help them, support them, let them know you care, and let them know you're there for them. Because there's so many things, as you can see on this list, there are so many things that a person can be afraid of with agoraphobia. Most people think it's just that they're afraid to leave their home, but they don't look at what the real situation is. That's when you can't leave your home. That's when it has gotten to the worst stage. If you think you have it, get help before it gets to that. These are some of the places people have. Shopping malls, cars, whether they driver or a passenger, bus, trains, subways, wide streets, tunnels, restaurants, theaters. There's a whole big list. We don't know what somebody else's fears are and what could cause them. You don't know what it's like to have anxiety disorder unless you have it yourself. People who have any type of anxiety disorder, when they have it, they get a tightness in their chest and it feels like they're having a heart attack. They actually feel like they're dying. And the least thing they want to hear is somebody cracking a joke about what they're going through. Instead, saying, I understand your fear. Let's see if we can work this out together. Slowly. Don't force them to face it all at once. Help them to slowly overcome it. Be there with them. Let them know you're going to be there every step of the way, and make sure they get the other help. Go to support groups. Learn more about what they're going through, whether it's agoraphobia, um, anxiety disorder, PTSD, no matter what it is. Make sure you educate yourself and get involved in every aspect of their treatment plan. Talk to them about it. Talk to their doctors, their care providers. Be there, encourage them, make sure that, their friends know about it. Be involved. That's what it's going to take. So remember, guys, and I say this with every video, you're important to me because you are. And I love each and every one of you out there for who you are and what you are. Because I truly see with my heart. And I cannot walk a mile in your shoes. So remember, until I see you again, I love you. Bye.